Yes, so global health is the largest part of our funding. So for our $8.6 billion budget, it is probably around 2/3 of the budget goes to global health. A mixture of that is on sort of upstream, what we call products and innovation, which will benefit all countries, not just India. So an example of a major set of new investments we got is we will be launching the world's first big trial for a new tuberculosis vaccine in over 100 years. And we're looking to see how some of that trial could be done in India and other places with high TB burdens in Asia and Africa. And we will spend hundreds of millions of dollars on that trial because the private sector is not willing to invest in it because the people who get tuberculosis are largely poor people who can't pay for treatments. So that's an example of investment that's not focused on India, but if it works, it will have very high benefits for India, which has a high TB burden. And as I say, the Prime Minister has actually set a very ambitious target for the eradication of tuberculosis. Then there's the work we do directly in India. We have a large array of sort of work there, particularly through our memorandums of understanding in Uttar Pradesh and Bihar, which are our two largest focus states, where we invest across health and agriculture. And so we support a number of efforts, technical support units in UP, for example. And we also work with the central government and in partnership with a number of philanthropies in areas from, actually I talked about the government's One Health initiative. We're trying to provide some support to. We work with NITI Aayog on a lot of their guidelines. We work on women's economic empowerment, supporting self-help groups, again, predominantly in Uttar Pradesh and Bihar, but more broadly. And increasingly, we're actually also looking at partnerships we can work with India that work outside of India. India's G20 was overall, we thought, very successful, and it particularly had a powerful call for how the rest of the world could learn from India on using digital public infrastructure to drive development, not just in financial inclusion, where there have been the largest advances using the Aadhaar, based on the Aadhaar digital identity tool, but also in healthcare and education. And so we're in active discussions. I actually recently did an op-ed with the head of NITI Aayog about how we hope the Brazilian G20 can take many of the lessons from India's G20 and drive those forward. And so a lot of our work with the foundation is not just what we can do in India to help support India, but actually take some of the innovations and lessons India now has and roll them out in other parts of the world, especially Africa.